We're going to go ahead and get started. Hello, everybody, and welcome. My name is Chelsea Byers, and I'm the Family Life Educator with University of Illinois Extension, and I'd like to welcome you all to our Summer Self-Care Series. This series is a collaboration between Illinois Extension and the Interdisciplinary Health Sciences Institute at University of Illinois. It is designed to connect those across the state with researchers at the university and provide evidence-based educational programming. If you have any questions during the program, we ask you to type them in our chat box. If you're calling in, please hold your questions until the end of the session. Just so everybody knows, this program is being recorded, so we ask that everybody leave their cameras off, but do note that the program is being recorded. A little bit about our speaker today. Noah Hutchinson received his Bachelor of Science in Exercise Science with a minor in Biology in 2019 from Truman State University. Noah's undergraduate research focused on the performance-enhancing effects of carbohydrate mouth rinsing in athletes. Noah is an American College of Sports Medicine certified exercise physiologist. Noah is a second-year PhD student in the Division of Nutritional Sciences at the University of Illinois. Noah's PhD research focuses on how certain dietary and exercise interventions interact with the two-way relationship between the gut microbiota, I hope I said that right, and our immune system. So without further ado, I would like to introduce Noah, and today he is going to be talking to us about training our immune system and outlining the effects of exercise on immune function. So take it away, Noah.
Awesome. Thank you for that lovely introduction. So as previously stated, I will be going over the effects of exercise on immune function today with you all. So kind of reiterating what was already said, I grew up in Mount Pleasant, Michigan, got my bachelor from Truman State University in Kirksville, Missouri. I'm currently a second-year PhD student in the Division of Nutritional Sciences at UIUC. I'm an ACSM certified exercise physiologist, and I currently study the interactions between the diet, exercise, and the gut microbiome and immune system. So some things I hope that you will take away from our talk here today will be some general facts about how the immune system functions, what exercise does to it, with particular concern to susceptibility and resilience to viral infection, as that's pretty important in our current time span. And hopefully you'll have some guidelines that will help you determine how to keep yourself safe and healthy using exercise. Quick disclaimer before I get too far into any of this, I am not a doctor. I am not your doctor either. Also, these strategies should be treated as helpful additions to prophylactic measures and should not be used as replacements to prophylactic measures. I 100% recommend that you continue doing your social distancing, all of your hygiene practices, washing your hands, wearing your mask, not touching your face, everything that you can be doing. And I encourage you to be very health conscious. It is often better to be safe than sorry. So I would definitely consult your doctor if you're uncertain about anything. And make sure that it's safe for you to exercise. If you're not already exercising, if you have an underlying health condition, it would probably be smart to get clearance from a health professional before continuing. And that requires inspection. So, the immune system is generally classified into two major arms. You have innate and adaptive immunity. So the innate system encompasses a lot of things. It starts with certain behavioral measures. So for example, there are certain smells that you are just you just don't like, and you're just born that way. You don't learn it. That's just how it is. Generally, that's designed to help you avoid certain materials that could contain large amounts of infectious agents. So it also encompasses physical barriers like skin and the mucus layers in your respiratory tract or in your intestines. The innate immunity is also responsible for inflammation. So if you've ever sprained your ankle or jammed your finger and you notice that it swells up, it gets red, it gets all warm, that's due to an inflammatory response from your innate immune system. It's also why you get a fever when you get sick. And the innate immune response generally concerns the fast-acting and less specific aspects of immunity. It's much faster and less specific than the adaptive immune system, which is obviously delayed. Generally takes hours to days to enact. It's long-lasting and is responsible for continued immunity. That's why with certain things like the chicken pox, if you get it when you're a kid, you generally won't get it again. That's because of your adaptive immune response. It creates a response specific to each pathogen, and this is responsible for why vaccinations are effective as well. It's essentially a impotent version of the pathogen that allows your body to mount an adaptive response. So these are classified as separate arms of the immune system, but they do in fact work together and help orchestrate each other and complete your entire immune response. So we asked beforehand, when I say immunity, what comes to mind? These are some of your responses, and these are some pretty good responses. I see a lot of things that definitely come to my mind when I think of immunity. So we will be getting into a lot of these things in my presentation here today, and if we don't get to anything, we can definitely help answer your questions in the chat after I finish or at a later date. So I thought it would be good to go over some of these terms so you are equipped to have a conversation or perhaps absorb scientific materials on the topic. So the term leukocytes generally refers to, I'm sure you've heard of white blood cells before. These are cells that are generally innate immune cells that aid in the clearance of pathogens and help develop the adaptive response. There's a lot of signaling that goes on there. And for that signaling, we have cytokines and chemokines. So these are best described as mediators. These are signaling proteins that are secreted by cells of your body that can actually activate or deactivate other defense mechanisms and attract or spread out other immune cells. If you hear words like interleukin and interferon, those refer to certain types of cytokines. There are a very large amount of specific subsets of cytokines. I think there are hundreds. And the profile of what types of cytokines are in your body at that time in large amounts can often be an indicator of your illness status. And I'll talk a little bit more about that in a second here. So up next we have antibodies. And antibody is kind of a blanket term for 5 classes of immunoglobulins. We won't get into that for time's sake. So antibodies are proteins that are produced by the adaptive immune system, and they're designed to specifically attack the pathogen at hand. And they're very effective and they're very efficient at that. So they're secreted by mature B cells called plasma cells, and they'll usually coat pathogens essentially and just render them ineffective at doing anything to your body. So if you've ever heard about like an antibody test for COVID-19, this is, a test to see if you've already had it, right? Because, they generally will stay with you after the infection. So a pathogen refers to any virus, bacteria, or microorganism that can cause disease or injury. Antigen refers to the portion of the pathogen that your immune system will use to mount responses. And this may come up later as well.
Noah, we do have a question
Yes.
in the chat box. It says, is it important to understand the different kinds of white blood cells?
So that depends on how deep you want to get into it. If you want to study the immune system, then yes, it is pretty important. I'm going to get into it a little bit here There will be some different types that will come up in the talk. But for time's sake, I didn't really have time today to go into the specific sets of them. However, if you're really hoping to gain a complete understanding of everything, I would say that, yeah, it's probably a good idea to look into all of the subsets. But it takes quite a while to do so. Does that answer the question?
Yeah, he says, thanks for the answer. No need for any extra detail now.
Okay. But yeah, if you have more questions afterwards, I can definitely talk with you afterwards and we can explain that a little bit better. The term lymphocytes will generally refers to cells of the adaptive immune response. The most common ones are T cells and B cells. But there are some others, and they can be naive and they can be mature, and you'll see a little bit of that later on. The term resilience, it's kind of self-explanatory, but it refers to one's ability to fight off infection. I'll be using this here and there throughout the presentation. Surveillance is kind of a speculatory term used by researchers in the field. Certain amounts of exercise can increase the presence of leukocytes and lymphocytes in the blood, and generally kind of refers to the ability of the immune system to recognize pathogens quickly and to react to them quickly. Viral load refers to the amount of virus particles in the body, generally in the blood, and can be used to measure the severity of illness. And pathogen-associated molecular patterns are what the leukocytes and lymphocytes will recognize and will initiate responses to. They don't actually recognize the pathogen itself, they recognize a molecular pattern. So this is kind of just a little flow chart of what happens after the pathogen gets past your innate barriers, meaning your mucosa or your skin. So you'll have cells of the body, leukocytes among them will act as sensors, and that will initiate certain pathogen clearance mechanisms within those cells and within other cells as well, and they will release mediators like cytokines and chemokines. And these cytokines and chemokines will act on other cells of the body and will help initiate an inflammatory response, which initiates vasodilation and production of other defense mechanisms to kill infected cells. And you'll see a little bit more in this next figure. So here you have, this is specifically with bacteria, but it doesn't happen with just bacteria. So here you have a macrophage, which is actually a subset of leukocytes, a pretty prominent one. So the macrophage recognizes bacteria via a PAMP, and will release cytokines and chemokines. And this causes nearby blood vessels to dilate their endothelium. And this will allow the exit of other proteins and other leukocytes like this neutrophil here into the tissue. So that's kind of the source for all of the redness, heat, and swelling, is the blood kind of leaking in there from the blood vessel. And then so, these mediators get in there and then they help, clear the pathogen, they help repair damage, and do multiple things really. So in generation of an adaptive immune response, a process that must happen is called antigen presentation. I'm sorry, this picture is a little bit blurry. So this antigen presentation will generally occur in the thymus or in the lymph nodes. So here's a dendritic cell. This is also another subset of leukocyte, and it's called a phagocyte. There are a few types of leukocytes that are considered phagocytes. It kind of refers to the ability of the cell to kind of eat the bacteria like we see here. So the phagocyte will kind of just absorb the bacteria, and then a portion of it, the antigen, will go to the surface of the phagocyte. And then that phagocyte will then, generally in the lymph node or in the thymus, present that antigen. In this case of this picture, it's presenting it to a helper T cell. And then that activates that T cell. And there are a lot of different subsets of T cells. And what a lot of these T cells can do is they will kind of do a similar thing that will help B cells mature, and it will initiate a process called clonal expansion, which will cause some of them to mature into plasma B cells. Some of them will also mature into memory B cells, which are responsible for memory, obviously. And then these plasma cells can secrete pathogen-specific antibodies, and this will take a matter of days. So this is just a quick summary figure of what all happens in the immune response. So once past the anatomical barriers and inside host tissue, leukocytes and certain body cells will recognize the pathogen and attempt to clear it with their own defense mechanisms, while also releasing cytokines and chemokines that will signal to other immune cells and other defense mechanisms and will activate them and attract other immune cells. They're saying, hey, there's a problem and we need help. So while the other leukocytes come over, some leukocytes, phagocytes, will bring the antigen to the lymph tissue for the maturation of specifically needed lymphocytes like T cells and pathogen-specific antibody-secreting plasma cells. And this will ultimately, hopefully, result in the clearance of this infection from your system.
Noah, we have another question before going on.
Sure.
If inflammation is part of the immune response, why do you try to reduce it with ice, NSAIDs, etc.?
Oh, that's a very good question. So, in general, the inflammatory response, it's good for a little while. I think the idea is really just to reduce pain, and I think the ice actually allows you to heal a little bit more effectively. Honestly, though, I don't know exactly why that is. So I could definitely talk with you after that. I'm not super educated in that area, but yeah, I think it's more about a reduction in pain and a regeneration of function, is why the ice is used. But yeah, to be honest with you, I'm not completely sure. Okay. So, with regards to COVID-19, COVID is responsible for kind of a non-specific but severe response. This is kind of what makes it dangerous. So what they've noticed is that in the severe cases of COVID, the immune cells will actually have a delayed release of the inflammatory mediators early on, and then later on will then release a very large amount of non-specific pro-inflammatory cytokines and chemokines, but very small amounts of the specific antiviral cytokines. Interferons are generally the antiviral ones. So this is kind of responsible for what they call the cytokine storm. I don't know if you've heard that word before, but this is, heavily related to the development of acute respiratory distress syndrome. So essentially, your immune system is killing you, and I'm sure the pathogen is not helping in that process either. And symptoms can vary widely. With COVID, they're finding that it can actually infect many parts of your body. So just be aware that it may not start with respiratory infections. So you may be wondering, what does any of this have to do with exercise? And to kind of get to that story, you have to first take a step back and look at something a little bit less specific. So first, what happens, as I'm sure some of you remember the talk Corinne gave, where you start with correlational analysis and large sample sizes. So there have been about 5 studies, at least, with about, on average, 1,000 participants each, and they'll follow individuals for a long period of time, 3 months to a year, and then they will, retroactively or concurrently will report their physical activity levels and their illness symptoms, and this can be via questionnaires or interviews. But if you look at the results sections over here, you kind of notice that a common theme in all of these studies is that the higher activity spectrum of individuals are less likely to report infections or days with illness or things of that nature. So this tells us that those who are among the more active portion of the general population are likely to report fewer days with symptoms of upper respiratory infection. But as I'm sure a lot of you are aware, this does not really tell us that exercise is the cause of this observation. It could be that people who exercise more, get better sleep. Maybe they are more hygienic. There could be any number of explanations for why this is happening. So, as referred to earlier in the series, this kind of gives us a snapshot, but it does not necessarily give us a movie of kind of what's going on here. So, in order to kind of get a little bit more control with our experiments, we turn to randomized controlled trials. So this figure here is kind of how it goes. You start with a cohort of individuals, you split them in half randomly, and then you randomize them to either exercise intervention. Most commonly, I think it's like an aerobics intervention. And then you'll have your sedentary controls, which often will do stretching or something like that. But the common theme here is that individuals in the exercise group tend to report fewer days of illness when studies are designed properly. There have also been some studies on clinical trials of regular exercise before vaccination. And in the elderly population, they have shown increased antibody levels following vaccination, but we are not completely sure if this has real clinical relevance. And research on this topic, meta-analyses have found that it's kind of inconclusive. We're not really sure if this is actually doing anything for us. So kind of overview, the consensus among researchers among the field is that they generally agree that regular moderate intensity exercise is beneficial for immune health and can decrease susceptibility to respiratory infection. However, meta-analyses and systematic reviews are somewhat difficult because a lot of the studies of the randomized controlled trial type have some variations in study designs that make them hard to compare to each other. For example, the length of the exercise periods, some of them will be 30 minutes and some of them will be 2.5 hour long sessions. These are not at all similar, and we'll get into a little bit later why those longer sessions could be problematic. And then sometimes, they'll only have them exercise for about a week, when in reality, it should be for quite a longer period than that to really see effects. It's also been noted that the effects that we observe in these studies are particularly large in the elderly and in individuals with excess fat mass. We don't know a whole lot about other modes of exercise, such as resistance training, and exercising regularly before vaccination may improve their effectiveness, but we're not completely sure. So, some other hindrances to immunity that can be aided by exercise. Well, actually, some hindrances, not other. I didn't say it before that. So immunosenescence refers to the aging of the immune system. As I'm sure many are not surprised, it gets less effective as you age and increases your susceptibility to infection and decreases resilience to infection. Exercise has been shown to counteract many aspects of this when done in proper amounts, which I will explain a little bit later. Exercise also has been known to combat chronic inflammation. This can be resulting from excess fat mass or chronic stress. Chronic inflammation generally causes wear and tear in the immune system, and inflammation in the absence of pathogens or damage throws off the delicate balance that your immune system sits in and can result in inappropriate responses to actual threats. So yes, exercise is very effective for both of these. Exercise has also been shown to aid in quality of life with certain autoimmune conditions. Generally, they'll it'll just be like the quality of life index. They haven't actually researched specifically immune biomarkers themselves in individuals with autoimmune conditions. However, there is some pretty good evidence that exercise is beneficial for those with multiple sclerosis and other other autoimmune conditions. Exercise has also displayed therapeutic effects in certain cancer patients, if they're healthy enough to do so. And it has been shown to prevent multiple types of cancer, but with the most of the evidence supports it being preventive for prostate and breast cancer. So you may be asking, how do I get these benefits? So what currently seems like the best recommendation for the general population is about 30 to 45 minutes of moderate intensity exercise, about 3 to 5 days a week. Also should note that those with health complications should seek advice from medical professionals concerning appropriate amounts and intensities, or even just doing it in the first place. So with that, we have a crowd question I would like to ask. Do you guys that are listening, do you guys exercise? If so, what are your favorite ways to do it? Put your answers in the chat.
Here are things that are coming up: yoga, walking, rowing machine, walking, walk daily, garden, ballroom dance, tennis, walking, sports, stretching, yoga, walking, lifting,
Awesome.
exercycle, run, walking, Pilates, HIIT, gardening, yoga, bicycle,
Okay.
kickboxing, walking, bike ride. I could go on and on and on and on. Great answers.
Okay, yeah, those are all really good examples. So I'm glad that everybody has so many ready to go. That makes me happy. So yes, I included a list here, but a lot of those that I didn't include on this list are all good. Dancing, Pilates, all of these things are all very good. And the most important thing really, it's not the type of exercise you're doing with concerns to like what specific activity you're doing, but the fact that you are doing it is generally the most important variable here. So the important thing is really that you're getting your heart rate up, you're hitting that moderate intensity rate, that workload, and make sure that you continue your social distancing while you do it. And 30 to 45 minutes is recommended. Obviously, if you're a healthy individual, I'm sure going up to an hour wouldn't be problematic. But 30 to 45 minutes is where we see most of the immune boosting benefits. Not boosting, I shouldn't say boosting, immune function benefits.
We do have a question in the
yes.
chat box about what heart rate is appropriate.
Yeah, so that's gonna kind of depend on your age. Generally about 60%, around 60% of your maximum heart rate is considered moderate intensity. So you can calculate your maximum heart rate by subtracting your age from 220. So if you're 20 years old, your maximum heart rate would be around 200 beats per minute. So generally about 60% of that would be considered moderate intensity. There's not really a one specific definition of moderate intensity. But between 50 to about 70%, I believe, is where most recommendations lie. But yeah, so there are many ways to calculate intensity. It's not just heart rate. But anyways, does that answer the question?
I hope so. And then somebody did ask about heart rate, number for heart rate not too high, and I think that you gave kind of the range, so that should be good.
Yeah. I would say like stay away from 80 to 90% if you are concerned about your immune system particularly. Obviously there are going to be athletes that are going to get up to that range, and we'll talk about kind of some ways you can help benefit that as well. And obviously sustainability is going to be really important. Most of these benefits result from interventions that last, a month or more. So you're gonna have to be able to you're gonna need to make sure that you can keep doing this for a while. And it's important also and this is kind of goes on the intensity thing. If you're not really an exerciser to begin with, it's important to start easy and work your way up. You don't want to jump into 90% of your heart rate max after not exercising for a long time. That can also be very problematic. So even if you can't reach that 30 minutes, 10 minutes will still be good for you. 15 minutes will still be good for you. So the most important thing is that you're doing something most days. And if you can't reach that 30 minutes, don't worry about it. You can work your way up to that. But yeah, just get out and do it. It can be helpful to find multiple things that you enjoy doing. If you have multiple things, you can switch it up. They say variety is the spice of life. It can help prevent you from getting bored with it, and help you, stick to it. So.
And Noah, one more question about that. Does your normal baseline pulse rate affect the calculation?
That depends on what method you want to use. With the simple one that I just stated, no, it does not. There are certain calculations that are a little bit more accurate and specific, called heart rate reserve, where they will use your baseline measurements. But I don't, I didn't include that in my presentation. I can get that information to someone afterwards if they're curious about how to calculate heart rate reserve. But so the short answer is sometimes yes. It depends on what calculation you're using. So some other important factors that are going to help keep your immune system functioning properly, and I think many of you already know these things. Adequate sleep is a big deal. Not only adequate amounts, but adequate quality, consistent sleep. Eating a balanced diet is very, very important. As I talked about, stress can be detrimental. So it's very good to make an effort to manage stress. And obviously make sure we're cleaning and sanitizing exercise equipment, because that's one really easy way to spread pathogens, and we do not want to be doing that, especially not right now. And if you're running on the sidewalk or around other people, make sure you're running wide paths around each other. Try to keep that 6 feet apart, because we know that we can spread infection if we get too close to each other. So, there is a question of, can you exercise too much? We've seen that there are benefits. I said 30 to 45 minutes specifically. So can exercising too much be a problem? So there were also quite a few of these correlational studies. There's actually a lot of them that have looked into the amount of symptoms reported in endurance athletes. So these would be like ultra marathon runners and things of that nature. And for the most part, they report higher than average levels of symptoms in these athletes, especially around competition time. So the conclusion here is athletes who take part in regular exhaustive exercise are more likely to report symptoms of infection, especially during time periods close to competition. So what this has led to is what's called the JCurve Hypothesis of susceptibility. It was formulated by a prominent researcher in the field. Essentially, his hypothesis is that while moderate intensity exercise will reduce your susceptibility to infection, but exhausted, prolonged exercise will actually increase your susceptibility to infection. If you follow this curve here on the graph, where risk is on the y-axis and exercise workload is on the x-axis, it's kind of a theoretical. There's not like exact values put in here, because that's, it's very individualized what is considered that. But so you'll see a reduction, but once you get to a certain point, you see the risk actually raising. It's important to note, however, that this is somewhat controversial. There are other researchers in the field that will actually debate this. There's actually a debate article that was written on this very topic. So can we really be sure that exercise is to blame? So some of the criticisms that have been mounted by other researchers in the field is that in a lot of these studies, they're not actually lab confirming the pathogens here. They're really just reporting them subjectively via a questionnaire or an interview. They're not actually taking a nasal swab and then lab testing for that pathogen. And so when you're competing, and I'm sure some of you have experienced this before, these competitions can cause stress and can expose you to a large crowd of people as well, which is obviously a very easy way to spread pathogens. There's a very high potential for carbohydrate inadequacy when you're training very heavily. And we'll get into a little bit later that exercising in a low carbohydrate state can induce a larger stress response, and which is not good for your immune function. And it could be due to allergies or some unexplained stimulus that we just aren't aware of at this current point in time. This is a relatively young area of research, so it could possibly be something that we just don't know about yet. So there was actually a study that did look into this. They took these athletes who were reporting these frequent symptoms, and they actually tested them in a laboratory. And they found that actually only about 30% of the symptoms were due to actually confirmed infections. So we know now that it's probably allergies or some other inflammatory stimulus that we don't know about. So there's been quite a few theories as to what the actual explanation is. So one common theory is that the excessive stress hormone release resulting from exhaustive exercise may be overly anti-inflammatory, and it actually may throw off immune equilibrium. There's actually some studies coming out recently of there being a genetic component of susceptibility to these symptoms, but we don't know for sure yet. The evidence is interesting now, but there needs to be more data before we can really confirm that. And this kind of led people to call this kind of like an open window. And one other thing that they have noticed is there are reductions in saliva flow and mucus layer, certain biomarkers in mucus layers after prolonged exercise, but the relevance of that has been mixed. The results on those specific studies have been kind of mixed, so it's hard to really say. There is one thing we do know is that prolonged high intensity exercise does result in a decrease in white blood cells and an increased stress release. So these could definitely be players in this phenomena. So some of you may be athletes who compete. Some of you, might be doing these long periods of exercise. So here's some things that you can do about it if you don't have a choice or if you're going to be doing it anyways. Make sure to keep your carbohydrate consumption high before and during exercise. And this is if you're competing. Obviously, if you spend 10 minutes on the treadmill, I don't advise you to eat a pack of chocolate, but keep it adequate before and during exercise. Low carbohydrate status during exercise can induce a much larger stress response, and that will negatively alter many immune biomarkers. There's also been some pretty good evidence for consistent consumption of polyphenols before exercise. So foods such as dark chocolate, berries, beans, nuts, and vegetables could all potentially help to kind of reduce some of these problems. So we kind of been going over like susceptibility to illness, and now we'll kind of try to dive deep on the severity of the illness. So it's obviously pretty hard to research the severity of a specific pathogen in a controlled manner in humans, because that would generally concern you, literally giving them an illness, which ethically is hard to do. There has actually been one study that did this in Ball State University in 1998. They did a 10-day moderate exercise intervention, which I would say is probably not long enough to actually do anything. And they didn't really see any good results. They gave them the common cold. So obviously, especially with a more dangerous virus, you don't really want to just be giving this to humans. That's pretty risky. There's a lot of liability. So due to these limitations, this is generally when we involve the animal models. So an animal model is very helpful because it may seem cruel or whatever, but it's very helpful because one, you don't want to be giving these illnesses to humans, and two, it allows you to kind of observe the effects a lot more because you can watch a mouse all the time. You can dissect the mouse afterwards. You can extract fluids, all of these things to see the specific biomarkers that are changing in result to the illness or your intervention for that illness. What they'll do with a lot of these mice is they'll put them on their running wheels for exercise, and they'll just kind of run them for a little while before they infect them with illness. Actually, 2 of these studies came from our lab here in Illinois. So what they found in these studies is that moderate intensity exercise a little while before infection with influenza specifically will actually reduce the mortality rate in these mice by nearly 40%. It'll actually decrease the amount of weight they lose, which is an indicator of lower severity of illness. And it decreases viral load shortly after infections. And in lean mice, it was found that the presence of pro-inflammatory cytokines in the lungs was greatly decreased by exercise. And this, as I said earlier, would indicate a less severe and more appropriate immune response in the mice that are exercising. So explanations as to why these things are happening are not complete here. We have quite a bit of speculation as to what it is. As I said previously, it could be just due to the increased amount of white blood cells in surveillance mode leading up to the infection. It could be that we know that increased renewal rates in immune cells. So like the old ones will die off faster and new ones will replace them a lot faster in individuals that exercise. So that could be good. And that could be happening here and helping them. Or it could just be, and we know that it's anti-inflammatory to exercise. So it could just be that alone. We're still not completely sure what is going on here. So there has been one study on mice where they infected them with a herpes simplex virus and then forced them to exercise to exhaustion on a treadmill. And they found that the mice that were exercised to exhaustion were about 25% more likely to die. And we haven't really done any research, and there were no analyses on the biomarkers involved here. So we would need more studies looking at these specific biomarkers to really figure out why this is going on. Most explanations are speculatory. It could be stress. It could be that actually this is overly anti-inflammatory. If you exercise too much, is a potential possibility. We really do not know.
We do have a clarifying question on that. Did the exercise continue during infection or prior to infection?
It was prior to infection. Yeah, they didn't have them exercise during infection.
Thank you.
Yep. This is just a quick slide about take-home messages from our talk here today. Regular moderate intensity exercise has a host of health benefits, and increased immune surveillance and resilience can be added to that list. If you want to hear more about the effects of exercise on immune health, there will be a talk on that on July 28th. Should be very interesting. Emily will be giving us a talk then. So while all the negative side effects of unfamiliar and exhaustive exercise may not be universal and apply to everyone, it is highly recommended to err on the side of caution in the face of a relatively unknown pandemic virus when risk of infection is abnormally high and we also do not have specific pharmaceutical treatments for COVID-19. So we want to make sure that we're extra careful because, they're still testing out a vaccine and specific pharmaceutical treatments for it. So we want to do what we can to keep ourselves safe. And so for the general population, once you have ascertained that it is safe for you to exercise, keeping bouts between 30 to 60 minutes. I would say 45 minutes is probably the sweet spot. About 5 times a week is recommended and seems the most beneficial based on available evidence.
And Noah, we did have a couple additional questions during your talk that I decided to hold till the end to make sure you had time for your program.
Yep. Now's my question slide. So.
Yeah, and so while I ask you these, I am going to launch a poll. This is an anonymous poll for our participants on demographics, so people could fill that out while you're answering these questions. So the first one was, and correct me if you already answered this one. So one was, if exercising 30 minutes, how long of that should be at 60% of max? Should your heart rate be at that 60% of max?
So I would say the majority of it, if you are able.
Okay, and then another question came in and it asked, how does exercise impact senior adults and their infection? Any research that you know of? So for example, any research on urinary tract infections and their lack of exercise? So when they have lack of movement, are they more susceptible maybe to urinary tract infections?
That's a really good question. I honestly don't know. I have not looked into that at all.
Okay.
I could certainly get back to you on that, but I personally haven't seen any research about that specifically.
Okay, and then another one came in and it says, does it matter if the 30 to 45 minutes of exercise 3 to 5 times a week is all at once and continuous, or can it be in the 10-minute increments, like 3 times a day, or 15-minute increments 2 times a day? And how does that relate to the amount of time at 60% max heart rate?
Yeah, so it definitely can be split up in increments. From what I've seen, most guidelines organizations will say that they have to be at least 10 minutes each to really count. I don't know if that should be considered like a hard line, or if you should just try to reach 10 minutes each time. But yeah, so if you can get to that 60%-ish, for the entirety of that 10 minutes and then split it up, that should be just as good.
All right, and those were the questions that I had so far. Let's see if there's any other ones. Let's see. What do you find let's see, what do you find what exercise is very important for older adults, like older adults in their 70s?
So the question is why?
I think it's what kind of exercise, or what maybe. Linda, can you clarify your question? And then another question came in. It says, if you can sustain the max heart rate for 30 minutes, oops, my box just moved, hold on. If you can sustain the max heart rate for 30 minutes, can you do a lower heart rate for an hour or longer to compensate? So if you cannot sustain the higher max heart rate, is a lower heart rate for longer, will that compensate?
Yeah. It certainly would. And also I would also encourage you to consider that maybe if you can't maintain that high level of heart rate, that maybe you should be working your way up. So maybe if you're not able to do the 60% for, 30 minutes, then maybe start with 40 and then work your way up. You don't necessarily need to, keep that workload up. It might be a good idea to start easier. But if you are a regular exerciser and you find that high of a heart rate is just difficult for you, then yes, you can certainly do that.
All right, another one came in. If you're currently exercising more than your recommendation, are you suggesting reducing the amount due to COVID-19?
So, I mean, with what we know about the immune function, it's really, you know, you're going to have to take into account your own individual risk and susceptibility. If you're an otherwise healthy individual, and you know, you've been doing that amount of exercise for a long period of time, I don't think it's that worrisome. It may not be the best possible thing for your immune function, but I don't think you would, you know, and I don't know the health status of the person who's asking this question. But if you're already, you know, very accustomed to that level of exercise, I don't think it would necessarily be a problem to continue it. Just make sure that, you know, you're getting adequate rest, hydration, and nutrition between sessions.
All right. Should people continue to exercise while sick?
I would probably say during, like, if you're having symptoms, I would say probably not. That's one of the reasons you will feel kind of lethargic during an illness period, is because your body is preserving energy for immune responses, is using it specifically for immune responses. So I would say probably not a good idea to exercise while experiencing symptoms, no.
All right.
But I would definitely consult a doctor on that for your specific case, because I think it does vary a lot depending on what you have, how sick you are, and all of these things.
Oh, and I see Linda clarified. She says that for older adults, it would be important for you to have exercise okayed by a doctor, specific exercises after having it okayed from a doctor. So with anything, if you're going to change your activity routines, it's always good to have clearance before you do anything. You know, I would say Noah would probably agree, right? Before any large changes to your normal activity levels.
Yeah, definitely.
So.
If it's a big switch and you're, you know, if you're above 70 years of age, I would say it's definitely a good idea to get clearance from a physician.
Okay, I think I covered them all. If I did not hit your question, you might need to re-enter it. I try to scroll through and grab all the ones from earlier as well as at the end. I am going to put in the chat box a evaluation for today's session that we would ask that you would fill out, as well as we do have a website where you can find all the information from today's session as well as past sessions. We are recording this session. The sessions usually get posted, the recordings usually get posted usually around 7 to 10 days later. So it will be posted, but give us time. We like to close caption the recordings before they are posted. So please just give us time to get that done, and I'm going to put in the link for, oops, somebody did it for me, thank you. Oh, not yet, sorry, it was the other one. The link for the survey for Noah's session today. We do ask that you fill out the survey. It is to help us guide future sessions, to help us know what other topics people are interested in learning more about. This has been a fantastic series so far, and next week's topic is making your habits stick. All you need to know to establish lasting behavior change. Any other questions out there for Noah? The slides will be on the website. Yeah, great job, Noah. And again, yeah, as you see on your screen, next week is with Jonathan Cerna, and he is from the Division of Nutritional Sciences. All right, thank you, everybody.